with sort of less regular use of antipsychotics. And now we have a study, and this is a study that I think everyone here needs to think about. And there's a graphic in the book, and discuss, and bring it up, and we as a society need to discuss. It's a study by Martin Harrell at the University of Illinois. And he began following two groups of patients in the early 1980s. It's an NIMH-funded study as well. It was a group of 64 schizophrenia patients, some from a private hospital, some from a public hospital, and then another group of psychotic patients with lesser psychotic disorders. And really it was more of a manic-depressive group. It was unipolar with psychotic features, manic-depressive with psychotic features, that sort of thing. And now we just followed. We looked at how they were doing in 2 years, 4.5 years, 7.5 years, 10 years, and 15 years. And here's what he's published his results in 2007. And really the graphics, I think, really tell the story. And you'll see these in the book. At the end of 2 years, and each time, at each follow-up, he just looked. Are they on medication? Are they off medication? Are they working or are they not working? Have they been asymptomatic or are they symptomatic? Those are the things he looked at. And to be in recovery, you had to be working at least more than 50% of the time. You had to have a good social life, and you couldn't have been symptomatic in the previous year. You couldn't be actively symptomatic, and you couldn't have been hospitalized. At the end of 2 years, this is the schizophrenia group, those off medication were doing slightly better than those on medication. It wasn't dramatic. But then over the course of the next 2.5 years, their fates diverged. And the off-medication group continued to get better as a group, whereas the on-medication group did not, such that by the end of 4.5 years, it was roughly 40% of those off-medication were in recovery, in that status, versus 5% of those on the drugs. So the recovery rate was 8 times higher for those off-medication. At the end of 15 years, it was the same thing. They were 40% in recovery, off medication, 5% recovery, on medication. So 8 times higher recovery rate. That's one. By the way, this is the best longitudinal study we have. That's one finding. The second finding is he also divided his outcomes into 3 groups. There was recovered, there was so-so, and there was poor. Now, among the off-medication group, it was 40% recovered, and it was roughly 44% in the so-so, 16% in the bad and in the poor outcomes category. With the on-medication group, it was 5% recovered and roughly 47% in the so-so and 47% in the bad category. So really what you see is the shift of chronicity of bad outcomes. It's like a shift all the way along the course of things. In terms of having psychotic symptoms, those on drugs, roughly 10 to 15 years, roughly 68% were still suffering from psychotic symptoms versus I think it was only 28% of those off meds. So we're 2 times more likely to be suffering from psychotic symptoms. Now when I asked Martin Harrell about the study, here's his interpretation. What happened was this. There's this group of people, he said, with a better internal sense of self than the first episode. They have sort of more willpower, let's say. And it was that group of patients, they stabilized okay in the drugs, and then they had the willpower to get off the medication. So there was sort of self-selection that this is the group that could do well off meds long term. So he didn't see that the meds were causing the problem, but just that, yes, there's a group of patients that clearly do better off medication. And at the American Psychiatric Association meeting, he stands up, this is in 2008, and says, there is no question that there is a group of patients that do better off medication, and we really need to adjust our care for that reality. But there is some other really worrying problem with this data, okay, that I think we at least need to worry about. One is, in the other psychotic disorders group, okay, again, it was the off-medication group as a group that did much, much better. In fact, as a group, they were basically collectively in the recovery category. The group on medication, actually, same sort of thing. At the end of 2.5 years, there wasn't much difference, whereas those off medication continued to get better, those on medication did not. And they ended up with a lot of disability, etc. But here's the real kicker of this study. We really end up with 4 groups in the study. We end up with schizophrenia on and off, and we end up with other psychotic patients on and off. And at the beginning of the study, the other psychotic patients on and off are clearly not as ill as the schizophrenia patients, right? They're less mildly ill. Here are the 15-year results. The best outcomes are seen in the other psychotic patients off medication. The second group is schizophrenia off. The third group, in terms of, we're going from best to worst, was other psychotic patients on. And then the fourth group was schizophrenia on. So the really worrying thing is that those with the other psychotic on ended up worse than the schizophrenia off. And you really have to ask, what's happening? Is there are the drugs sort of iatrogenic over the long term for at least some patients? Okay, that's the long-term outcomes literature. And there can be many explanations. I do think as a population, and I wrote this in an editorial, at the very least, as we discuss how to help people and what sort of society we should have, we should know this information, right? And we should know at least that there's this possibility that many people will do better on medication. And we should know that, discuss it, and incorporate it into our paradigms of care. The Harrow study was published in 2007. By the way, he was warned, he was advised not to publish the study because it would be bad for psychiatry. His colleagues said, don't do that. Those results never appeared in any American newspaper until I gave a talk in Worcester, and then it was covered by the local Worcester paper, and they printed it. Now, why weren't these results published? It's the best longitudinal study we have. And imagine if the results had been the reverse. If the recovery rate had been 40% for those medicated and 5% for those unmedicated, you would have had, that would have been front page news. It would have been shouted out from the rooftops by NIMH, from NAMI, from the American Psychiatric Association. It would have been press releases. It would have been front page news. But this news was so dispiriting, there were no press releases put out. You can't find it on their websites. And even today, if you look at the modern edition of the American Psychiatric Association textbook, it's such a prominent study they can't ignore it. So how do they spin it? Here's what they say. Here's what psychiatric residences read now. The Harrow study proves that there's a small group of people who do not need the continued benefit of antipsychotic medications. So they spin it in that way. So what's the good news here? The good news is, imagine if we had a form of care where first episode patients were not immediately put on neuroleptics. And instead we tried with these 18, 19, 20-year-olds, we tried to get them through that psychotic episode without putting them down this long-term path. Seems like it might work, right? Well, fortunately, there's been a group doing exactly that since 1992 in northern Finland, in western Latvia. And they've been charting their 5-year outcomes. And they now have, by far, the best outcomes in the Western world. And here are their 5-year outcomes. At the end of 5 years, with their first episode psychotic patients, 80% are either at work or back in school. 80% are asymptomatic. Only 20% are on disability. There's their medication use at the end of 5 years. Oh, by the way, during that initial time, they will use benzos to help people with their agitation and sleep, etc. It's not a no-med thing at all. It's just they don't want to put people on neuroleptics if they don't have to. Here's their medication use in terms of antipsychotic medication use. At the end of 5 years, only 1/3 of their patients have ever been exposed to antipsychotic medication. At the end of 5 years, only 20% are on drugs. So there's a group that uses them temporarily and then comes on. So you can see that this is basically, it's not a no-med use, it's a best use med. And they're saying that some people do better without, some people need it temporarily, and some people need it long-term. I don't think anybody can say that's an anti-med model. The other thing, a couple other things really interesting. One is the employment rate for that 80%, okay, that are back in the workforce. The unemployment rate for that group is lower than it is for the Finnish population as a whole. It's 7% in that group of that 80%. It's extraordinary. The other thing is that's happening in that area of Finland is that schizophrenia is disappearing. Now, in the 1970s, that part of Finland, Western Lapland, had one of the highest incidences of schizophrenia in all of Europe. It's a population of about 70,000 people, and they had about 27 new cases per year, which is a lot if you do the numbers and figure it out. But what's happening now with this new form of care since 1992? Well, what's happening since this is a very sort of gentle form of care, there's no forced medication, etc. People